Okay, so as promised, I want to go through the PAIVM section on Mr. Plastic Spine here. Okay, so we're going to start with central PA spring test, the extension or posterior tipping at that cervicothoracic junction. So about C6 down to T3. So 1, 2, 3, 4, 5, 6, 7. Okay, so I'm going to start here just to show you on C7 and T1. Okay, I'm going to use my thumbs over the spinous process in this V-shaped fashion. Okay, my direction of force is going to be posterior to anterior with a little bit of a caudal slant to it. So you can see, if you back up, you can see the direction of my forearms. It's in a PA caudal direction. Okay, now if you come up close, come here so they can see that. When I do this, it creates a down glide or a posterior tipping. All right, you don't have to get that close.
Yes, I do.
Oh, yeah, you do. Okay, sorry, that's deceptive. A posterior tipping or extension of C7 on T1. So this is what happens when I do a PA in a caudal direction. Okay, you see that facet joint like that. That is extension with a posterior tip of this vertebra. Okay, all right. The next one is if I were to come from the side, okay, and this is the rotation at the cervicothoracic junction. If I were to push on this spinous process from the right to the left, I'm going to be creating right rotation. So I'm over here and I'm forced that way, creates rotation. Now, is it specifically just to this vertebra? No, and you can see how a few above and below go as well. Okay, so it's that. So you can see it would create left rotation if this person were allowed to turn their head. Okay, that's all in kind of this upper thoracic, lower cervical, but I could come and do these transverse pressures all the way down the thoracic spine, and then I would come and I would check in the opposite direction. Okay, there's rotation. Okay, so now I'm going to do a PA spring test. Okay, so we're talking here really from about T3 and down. So if that is 1, 2, 3, 4, 5, 6, 7, that's T1, 2. Okay, once that that angulation from that cervicothoracic junction kind of ends, it's easier then to use my pisiform contact here on a spinous process. Again, my other hand is monitoring paraspinals. Okay, my direction of force is in a PA direction with a little bit of a caudal slant. Okay, so you can see if I push in that direction, okay, especially down here where those spinous processes are so angulated, of course it creates extension. But up here where you can see the movement, can you come over here so they can see this? If I do that, you can see how this facet joint here glides posteriorly and inferiorly on the one below it. Guys, can you see that loop?
Yeah.
You need to be up a little bit. Here you go. Like that. Okay, maybe be up above a little bit. There. Whoops. Sorry, guys. Move your fingers in the way. I can do this. I got it. That. Okay. All right. You got it. Don't block it with your hands here. Okay. So that is central PA spring test via spinous processes. Okay. Now, here comes what I hope is not confusing for you. I feel like you're like in my face. They don't need to like see nose hairs.
All right.
They don't want to see that. Okay. Now, here's what I want to show you guys. If I were to do a PA spring test, but use a middle finger and an index finger, but do it over transverse processes. So I need you to make sure they can see what's going to happen in these two joints. So maybe come from above. Hold on, guys. Let me think about this here. Here, why don't you be there? You can see kind of that angle. If I were to take my 2 fingers and put them over one segment, one vertebra over its transverse processes, could you guys see how if I came here with my ulnar border of my hand, how it's going to create a gapping between these 2 vertebrae? I feel like they're seeing that. Sorry. Here he is again. Hey Luke, come here. Oops. So if I'm on this vertebra and I push down towards the table, do you see how it would push this facet here? This is the superior facet of the inferior vertebra away from and down towards the table from the inferior facet above, and to create basically a gapping or an opening between this vertebra and the one above if I were to push this way and down towards the table. Okay, so that is what we're doing with the gapping. And if I move down a segment, then it becomes gapping this vertebra, moving it down towards the table and separating these 2 facet joints here. So it's creating a gapping, okay? A gapping this way. Now, here's where I talk about the whole rule of the bottom finger, okay? So here I was doing a PA and creating a gapping at this facet joint, okay? The one above this vertebra. So this vertebra from the superior vertebra creates a gapping at this facet and the one on the other side, okay? Now, what if I were to, if this is, and I'm not going to count, but I'm going to guess that that's like 1, 2, 3, 4, 6-ish, okay? T6 on T, no, I'm way too far down, sorry, 1, 3, 4, 5, 6, 7, T1, 2, 3, 4, 5, 6, 7. Okay, so let's do T7 on T8. Okay, so this is the T7 vertebra, this is the T8. Okay, so here, if I were to move this index finger up to the side, to the right side of T7 and keep my middle finger on the left transverse process of T8, could you see how if I applied a posterior to anterior force through both fingers, okay? I'm actually holding the camera right now, so I can't use my ulnar border of my right hand, but I think this is going to be easier to show you. If I were to impart a PA force here, could you see how this would create a left rotation of the superior vertebra on the inferior vertebra? So basically I'd be pushing this way. Oh, look, just like that. The left rotation of T7 on T8. Sorry, I gotta put you back together. I caused a little bit of a dislocation. But that is what happens, okay? So basically, the way I think of it is that I'm pushing, never mind, I'm not gonna say what I was just gonna say. Rule of the bottom finger, left rotation of the superior vertebra on the inferior vertebra. If I switched it, right rotation of the superior vertebra on the inferior vertebra. So right rotation, the rule of the bottom finger is that my lower finger is on the right side of the spine, so it's going to cause right rotation of the superior vertebra on the inferior vertebra. I hope that that made some sense to you. Okay, now I'm turning you back over to this cute little bugger. All right. Now, let me catch up and make sure I did that, and we did that. Okay, now, so for this one, if I want to do a unilateral PA using my pisiform, okay, I can have my pisiform on the thoracic vertebra that I want to test here, but I'm going to use my other hand to stabilize the invisible rib that is attached here at this costotransverse joint. I'm stabilizing it, okay, while I do a PA force over here, okay? So you can see how if I'm on the right side of of a vertebra here, it causes left rotation, right? But if I didn't stabilize over here, then the rib that's attached here at this transverse process is just gonna rotate with it. So if I'm a rib, everybody's gonna go this way, okay? Or I can block the rib over here and do a better isolated rotation to that vertebra into, because I'm on the right side, it would be left rotation, okay? So hopefully that makes some sense. And then instead of using my pisiform, I'm gonna come and I'm gonna use my thumbs. I can also, if I'm on the right side of a vertebra on its transverse process, I can create left rotation. This time though, I'm not stabilizing the rib, so the rib's kind of free to come with this vertebra. So it's not really just isolated to this vertebral segment. Okay, so that's what that is. Now, I'm gonna do this on your side. So if you can see here, these are the facet joints between successive vertebrae. So if I'm gonna do more of a purely Maitland UPA, I'm gonna do a PA force. So I'm not gonna be in the spinous process, not gonna be in the transverse process, we've already done those. Now I'm gonna do more of a traditional UPA. I'm gonna be in between the spinous and the transverse process with a thumb and deliver a unilateral PA force. Again, we're not talking arthrokinematics, we are talking purely provocation for painful segments or segments that actually decrease the patient's symptoms. We can also make some assessments as to how much mobility is there. Okay. And then we did ribs, but this person doesn't have any ribs, so we can't do that. Yeah, everything else is ribs. So, okay. So I hope that cleared some things up for you. Rest assured, we will talk about this a lot during our activity tomorrow.